Metformin is in the top 10 drugs NCLEX loves to test on. So you have to know these things in order to master metformin on your exams. All right, so metformin is an oral medication. It's for type 2 diabetes, right? Only for type 2, okay? And what it does is it helps the body to use insulin better, okay? So it's not gonna drop your blood sugar, so it does not cause hypoglycemia. They love to ask this. So it's just going to help your body use it better, because in type 2, they're insulin resistant. They still make insulin, but it doesn't work very good at all. So they're going to help them make insulin better. This is considered first-line treatment, so you do need to know that for metformin. Everything on metformin goes off of the kidneys, all right? The kidneys are the basis for metformin, all right? It is very, very tough on the kidneys, all right? So anytime in pharmacology that a drug is tough on the kidneys, you have to monitor BUN, creatinine, and urine output. Automatically, we're just going to be keeping an eye on those, okay? Because it's tough on the kidneys, they can't get rid of lactic acid very effectively, so you're going to go into lactic acidosis. This is the number one tested on thing for metformin, is it causes lactic acidosis. How do you know they have that? They're going to start rapid breathing, trying to blow off the CO2, okay? Because when we go into acidosis, we build up an acid. CO2 is our acid, so they're going to and they're going to start developing myalgias, which are muscle aches, because that lactic acid is going to build up in the muscles, causing muscle pain. You start seeing this on an exam, rapid breathing and myalgias are on metformin, think lactic acidosis, big deal, all right? Because it is hard on the kidneys, remember everything in metformin is kidney, you need to hold the metformin if patient is getting contrast. This is one of the most testable things, all right? So if they're getting contrast like a CT and MRI, you need to hold metformin that day and usually the day after, but they can't just have crazy blood sugar while we hold the metformin. So we're going to give them sliding scale insulin while we are off metformin, okay? Give the kidneys a chance to get rid of the contrast. Contrast is hard on the kidney. Metformin is hard on the kidney. They're going to compete. I don't want one of them to win and one of them to lose. All right. So we're going to hold the metformin. If they're getting contrast, give SSI in the meantime. Another question they love to ask is the patient's like, oh, you're giving me insulin. Does this mean I'm insulin dependent? No, I'm only giving it to you while we're off the metformin and letting this contrast clear your kidney. All right. Other big giant thing they like to ask is a patient with metformin comes in and complains like, oh my God, I'm on the toilet 24/7. Right. Yes, we would expect that. GI upset is actually normal, especially at the beginning of therapy. It will get better with time is how we're going to respond, but you're always going to say the therapeutic thing first. Like, I'm very sorry this is happening to you. I know it's very difficult to live on the toilet, but this will get better with time as you're on the metformin. All right. And remember, it does not cause hypoglycemia. So, with any diabetic patient, we're still going to teach them signs and symptoms, but this is not something that we're going to worry about because it does not drop their blood sugar. It just helps them to use insulin a little bit better. So it's not going to cause a massive drop. Did you know all these things about metformin? I have a pharmacology list if you want to go over the most testable drugs for NCLEX and exams, and I go over the need to knows for each drug. So be sure to check that out.